Unexpected things that can happen in life. My grandmother actually had a chest pain and collapsed right in front of my father and sister. They didn't know what to do. Imagine sitting in a restaurant and you actually see someone choking on food. You're all familiar with this clip from Mrs. Doubtfire when Mr. Pierce Brosnan is choking on food, and this goes on for a few seconds. And then the choking is relieved by Mrs. Doubtfire, played by the legendary Robin Williams. Now, Pierce Brosnan has a very special attraction to choking on food in his life. So recently, this happened in real life when Hal Berry said Pierce Brosnan saved her life during the filming on Die Another Day. Well, what would you do if this happened to you? Do you know what to do? Comment below, yes or no. There are other situations that can happen at work or at home with own family members, like they can fall down, they can have an electric shock. To help someone, you don't have to be a doctor or work as a healthcare professional. Anyone can help in this situation where the first few minutes can be very crucial to save life until a medical help becomes available. Well, today we are very fortunate to have two certified life support experts with us today. Not one, but two. So one is Dr. Harshad Gurnaney, and the second is his daughter Ria. So welcome.
Good morning, Raj.
Good morning and welcome, and thank you for being here. So Dr.
Thank you.
Gurnaney,
And here's, I'll show Ria too quickly.
hey Ria, thanks for being here. So Dr. Gurnaney is an anesthesia specialist doctor in USA, and Ria is his daughter, who is a high school student and is also certified in basic life support. They will show us how to correctly apply these life-saving skills to the things you can unexpectedly see in your life. Make sure you see till the end. You don't know whose life you can be saving someday. I'm Dr. Raj Iyer, an anesthesia doctor tuning in from New Jersey in USA, and this is our live session and Ask the Doctors. This is one-stop shop for all information on health for you and your family. If you're a returning viewer, check out our other videos in the Ask the Expert series by clicking the link at the end of the video. So I'm very honored today to know Dr. Harshad personally, and I recently learned he enjoys paragliding and has done this in this beautiful country of Switzerland. So how was that experience, Harshad?
It was a little scary and kind of goes to one of the things I always talk about is the importance of communication. So it was funny and scary. It was fun when you did it. So we jumped off a mountain in Jungfrau, Switzerland, and then we kind of landed. But the instructor didn't speak a lot of English. So I don't think I told you this, Raj, but we were jumping off and he was kind of joking a little bit in somewhat broken English, but like kind of about like how to do the landing. And then he said, when you land, don't run right away because the parachute will open again and we might take off. So he said, I'll let you know when to run. So I'm ahead of him, he's behind me, we land, and I'm waiting for him to tell me. And then all of a sudden, I see him shoot out in front of me and start running. And he's like, so I kind of got dragged and then finally got up and started running. And I'm like, you never told me to run. He's like, oh, I forgot. So it was kind of funny. I kind of scratched my knees a little bit, and my wife was videoing this, and she's like, why didn't you run either? I'm like, he told me not to run. So
Well,
it's kind of important. He was kind of focusing on making sure we landed safely, and he forgot that he had told me that I shouldn't run, and or maybe he wanted me to run, and then because of the language barrier. So it was kind of funny that way. But after that, I've done parasailing, which is kind of similar, but you get off of a boat with the kids. So Ria's done it too with me, and it's kind of fun to be up in the air, kind of get the view from up there.
that's great. So that's the importance of life-saving skills that we're going to talk about today.
Yes.
Here is a little disclaimer. I just want you to look at this and also check the disclaimer in the description below. I want to remind you to post your questions in the comment section, and if you would like to join live, just use the link in the description below and you can join us using any device, including a phone. So without further ado, so let's get to what we can do. So let's say, Harshad, we see someone who has actually fallen down. You know, this can happen quite frequently. So let's start with a child. Um, you see a child who has fallen and is not responding. So, what should people do to begin with? Can you go over this?
So I think if the child is not responding, the first thing to do is kind of move the kid. Like obviously he's lying on stairs, so you can't really do CPR there. So if you can safely move him to a flat surface and check responsiveness. And then the next step would be to call 911 in the US, but in other countries, you'll have to see what the number is. I believe it's different in every country. Once you've done that, and if you can check either the neck or the wrist where there is a pulse, and if you do not feel a pulse, it's very important to right away start chest compressions. Um, and you can go depending on the age of the child, but for most kids who are not less than 1 year old, you'll be doing chest compressions at the rate of 30 and then kind of giving them two breaths and kind of repeating that cycle. And you want to do that at the rate of about 100 a minute. So it's pretty fast, but you can, if you practice it a few times and you kind of have done it before, it will be pretty easy to do it, even in a stressful situation. And you keep doing that in 2 minutes, like in cycles. If you have a second person to help you, usually you want to give each other a break after about 2 to 4 minutes. And we can have Ria actually demonstrate that for us on the child first. I'll turn the camera over to
Yeah,
her.
that sounds good.
So this is Ria. She's actually got trained in BLS, basic life support, when she was taking a babysitting class for school.
Mm-hmm.
And so this is kind of just a child mannequin, and Ria's going to demonstrate by counting out loud how to start CPR. So you kind of go between the, kind of in the middle of the chest bone. Usually they say at the level of the nipples, and kind of do both hands and have your shoulders above the mannequin or the child, and then do CPR. Go for it, Ria. And as you can see, it's a little bit tiring, right, Ria? So usually you want to give each, if you have two people doing this, you want to give a break after about 2 minutes.
Okay. So essentially, you see an unresponsive child, you're going to go to the child, you make sure the child is actually not responding to your commands, and then you start pressing on the chest, like exactly like how Ria did. So you said it's
Yeah.
30 times,
And then give two
and
breaths.
then give two breaths, right? And then come back to the chest compressions. In the meanwhile, you actually ask someone to call for help. So they actually call for help while you're trying to save the life of this child.
Yes, exactly right. Thank you for summarizing. But yeah, that's kind of the steps. And in fact, you probably want to call for help. And most of us have cell phones now, so you could kind of start doing that while you're checking responsiveness and then start doing the compressions. So,
Mm-hmm.
and a lot of times, at least in the US, the EMS will kind of stay with you and coach you if you want them to do that.
Mm-hmm. Well, as Harshad said, every country has their own different emergency numbers. So in the US, everyone knows it's 911. Um, and in India, it's 102, or I think it's 108. And again, Australia has a different number, UK has a different number. Every country has their own number. So you just follow your guidelines to call that emergency number while you're trying to do this uh, until you get a medical help.
Yes, exactly.
So that was good about knowing about the child. And what do you think if we find someone who is an adult who actually, it could be our friend, it could be a family member who actually is not responding now and then is collapsed on the floor. So what should we do there?
I think it would be the same three steps. So PALS and ACLS, or as we call it, basic life support, doesn't change as much because the American Heart Association, which kind of sets most of these guidelines, wanted to keep it simple for lay people or people who are not in the medical field. So it does get a little slightly different when you get to an in-hospital setting where you're doing more. advanced life support, as they call it. But for basic life support, it's still the same. Check responsiveness, call for help. And along with call for help, it's also call for an AED. So especially in adults, a lot of times it could be an what we call a cardiac arrhythmia, or your heart is not beating. So if you can give that electric shock, that might help too. And a lot of public places, the AED will be available. So using that, but the ratio again for chest compressions is still the same, 30 compressions to 2 ventilations. And if the AED shows up, it's usually pretty self-explanatory, but if you have a chance or if you take a basic life support course, they'll show you the steps in using the AED. But once it comes on, it pretty much talks you through how to use it. So you kind of apply it, it has pictures on where you can do it. And usually the person who is helping the patient breathe has a little bit more time to do that. So they would be the ones who would kind of be doing that piece of applying the AED, and then it kind of walks you through what to do.
Okay, so that's great. Just to summarize, I think what Harshad said. So essentially, if you see an adult who is not responding, it's the same thing. You check for responsiveness. You do 30 compressions that reassure, and then 2 breaths. Plus, in addition, you also check for AED, so which stands for Automated External Defibrillator. So I just want to spend 1 minute extra on this, just because our viewers can be not doctors. So this is a device which actually sits in most public places in developed countries. So if you're not from any of the developed country, you may not have the luxury of finding the AED everywhere. So in that situation, you still continue doing your chest compressions, your breathing, and then wait for the medical help personnel to get in to help you out. But if you have an AED, you can actually attach it, and as Dr. Harshad said, it's pretty self-explanatory. Once you attach it, it just goes through all the steps. Is that right?
Yes, it does go through all the steps. It will tell you when, and usually the steps involve it kind of detects what the rhythm is underneath. So it has like an electrode in it, and it tells you whether you need to shock the patient or not. And usually there's like a big button which says charge, and then a second big button which says shock. So you charge and then you shock. And if you hit the charge button a second time by accident, it kind of takes the electric current away. So it's pretty safe. It's very easy to use on purpose. And like Dr. Raj said, it's available in most public places. So at hotels, convention centers, even in malls, you will have it available.
Mm-hmm.
And if you call for help, usually, if you're not familiar with the place, hopefully the security guards or someone who's there will know where to get that equipment for you.
Okay, that's great. So the next thing is, we'll again go back to the child. Um, Choking on food can be very common and very scary, especially in all age groups. But let's focus on the child. If someone sees a
Yeah.
child choking on food, so what should they be doing?
So again, I think once you kind of make sure that they are responsive, so again, if they become unresponsive, you go back to doing CPR. So like we just showed in the previous section that you would do the chest compressions at the certain rate. But if it is someone who is kind of awake but still like gasping or but still responsive is what we would call. So they're able to talk, not maybe talk to you because they're coughing and stuff, but they're awake enough. Then what you can do is as you saw, if it's an older kid or a child who's bigger, you can do what they call the Heimlich maneuver, which was very well demonstrated in the video that Dr. Raj showed earlier with Robin Williams. So Ria can kind of demonstrate it over here, but it's basically you would put pressure kind of below your sternum and kind of, here I can actually show it to
Yeah,
you.
sure, yeah.
So you would kind of hold pressure over here. You kind of come behind them, make them lean forward so that the foreign body will come out, and then you kind of hold pressure over here. So you kind of do that a couple of times and see if that will help them bring the foreign body out. And then Ria can also show us to us. So if it's a smaller child, so say if it's an infant or someone who's under 1 years of age, whom you can kind of hold in your hand. And it's a pretty common age to see that happen. So what you would do is you would give them five thumbs on the back, and then kind of keep them leaning forward a little bit. So, and then do five thumbs on the front and see if that dislodges the body, foreign body from the patient. What you do after both doing the Heimlich, so obviously being a movie, the foreign body, if I recollect correctly, like kind of spit out of his body and went in. More often it will still be in your mouth. So you would ask them if they're responsive to open their mouth and just kind of take it out. If you don't see it, the recommendation is don't put your finger in. They used to talk about doing a blind sweep, and now they don't recommend it because the worry is that you might push it in more.
Mm-hmm. Mm-hmm.
So the worry is if you push it in more, it might block the breathing pipe even more and make the situation worse. So only go to remove it if you don't see. And at any point in this, if the child becomes unresponsive, then you would start CPR. Unresponsive being that they're not responding to you kind of shaking them or waking them up.
Okay. So I think you made a good point about not putting the finger in to try to take the foreign body out, because then there is a risk that it can be pushed deeper inside, but rather do the thumping on the back and on the front. So you showed two different things. One, you showed the thumping on the back and front on a small baby, and also you pressed on the lower part of the chest here. So what age group should that be done and this be done?
So usually they say under 1 year, but if you can hold a child in that fashion, so if you have a smaller kid, like even a 2 year old or like a 16, 15, 16-month old whom you can hold safely in that way. But if it's a 5 year old and you're not able to be holding them like that, then you would do the Heimlich. But you want to support them and kind of whatever maneuver you do, you want to make them lean forward because you want to make it natural for the foreign body to come out. You don't want it to kind of come out and then go back right in.
Mm-hmm. That was great, Harshad. I think it's very helpful. Actually, I have to tell you, when my child was younger, we were eating in a restaurant, and she actually started choking, and I was in one of the restaurants in Cincinnati. Then I had to hold her and then tap her on the back, so she was actually relieved. So I actually have had to unfortunately personally use it, but used it successfully.
Nice. And that's the biggest advantage. So I was reading a little bit about it when I was teaching one of these courses recently. And it kind of, they said that about, I think 60 or 80% of foreign bodies happen in the 1 to 3 year old age group because the kids in that age group are naturally curious. And the way they feel things or try to understand things is putting in the mouth. And if it looks nice and shining, it will probably end up in their mouth.
Mm-hmm. Okay. Well, the other let's move on to the next thing. The other common thing people see is actually drowning. So this can be an
Yeah.
adult drowning in a lake, or even in a pool, swimming pool, and children. Children just randomly fall down, and they suffer drowning, which is very scary, and can happen in Um, unfortunately, we see this quite often. So, what should people
Yeah.
do when they see someone drowning or who is drowned?
So again, like if you are obviously trained enough or a good swimmer, but typically you would hope that there's a lifeguard there or someone there who can bring them out of the water. That's the first step. And then if they're not responsive, you pretty much would follow the same basic life support again. So you would do chest compressions and then try to ventilate them at the same ratio, 30 is to 2. And if it's a younger kid, so what they say is less than 1 year olds, you would do 15 is to 2. So a slightly faster rate of giving them breaths because children need a little more oxygen. But beyond that, I think kind of continuing the CPR cycle and again calling for help. So usually the paramedics will be on their way when that happens, or even the lifeguard might have called it. So, and again, that's the importance of prevention. All these things, the biggest thing is prevention. So it's summer season in the US. So a lot of accidental drownings happen at pools that are in people's houses, especially if they're not used to having young kids and someone visits them. So a lot of people have alarms and stuff like that. So kind of investing in those things because even any one of these cases is devastating, and we do see them routinely. Actually, yesterday, one of the fellows I was rounding with said that that's one of her biggest fears is that when she has children, she'll probably never buy a house with a pool because she's seen so many kids working in the ICU here
Mm-hmm.
who are victims of accidental drowning because they kind of just walked into a pool.
Yeah, yeah, that can be scary. So if they're in a pool, just follow the same precautions and continue the same uh,
Yeah,
chest compressions and breathing, right?
yeah,
And do they
yeah. So it's the
actually?
same precautions, and then just be careful because the other thing that they warn is make sure there's a lifeguard or someone who's more trained. Like what you don't want is two people drowning. So you might think you're a good swimmer, but it's always hard to pull someone out of the water
Mm-hmm.
because they are just extra weight. They're not going to be able to help you.
Mm-hmm. And if someone is actually, what was I about to say? Any precautions with AED? If someone is drowned, the external defibrillator automated device.
I don't know for sure, but I'm pretty sure you'll have to dry up the area that you put it on, just because it is an electric current. So the worry would be a little bit more of the current arcing, but I would think that once you wipe the area where you're applying the AED, it should be okay.
Mm-hmm. Mm-hmm.
But obviously, if it is very wet and you don't want to use it, then I think I would continue chest compressions till you get more help to come there. And the EMS or whoever else responds might have kind of the appropriate devices to make sure they can dry the body before they put those devices on. But you definitely don't want to put it on a wet surface.
Okay. So it's pretty important to pull them out of the pool or wherever they have drowned and then start the
Yeah,
chest compressions and breathing while you actually get some medical help. So that can actually be life
yeah.
saving because that initial few minutes makes a huge difference.
Yeah, and actually the rate of bystander CPR, even in the US, which is a developed country where they have all these trainings. So Ria is a high school student, and probably half of her class has done some of the babysitting courses and has had this kind of a training. She's just nodding her head. But even in a country which trains a lot on basic life support, the rate of bystander CPR is around 30 to 40%. And the rate of AED application is like as low as 10%. So AHA is spending a lot of uh, public service announcements and stuff to kind of propagate people doing early CPR and also feeling comfortable using the AED.
Mm-hmm. Okay, that's great. That was helpful. Thank you. So moving on to the next thing, the other common thing we see in houses or even outside is having an electric shock. So
Yeah.
electrocution can be unfortunately very common, and US has 110 volts, but India and so India has 220, and many other countries have different voltage. I cannot tell you how many times I've been had an electric shock, but everything has been minor. But I know that people can have major electrocution. So what should someone do if they see someone having an electric shock?
So I think the quickest thing to do is if you are familiar with the location. I'm assuming if it's your house, you can turn off the source. So if they're working, and which you should do before you work on any electric equipment. So if you're working on electric equipment, it's best if you can go to the main power source in your house. And if you have some kind of a circuit board, turn off the piece. But if you've not done that before, just go and just turn the whole power supply off. It'll probably be the fastest thing to do. And then you can move. That will obviously stop the person from getting more of an electric current. If you don't know that, then what you could do is try to use a non-conductive thing, so like a cardboard or a piece of wood, and try to separate them from the electric current. So you don't want to hold them directly because your body is a conductor, so you will get electrocuted too. And again, if you are in working in situations where it's wet, so like we talked about with the AED, you don't want to be doing that either. So again, move them away from the source of electricity either by shutting it off or by pushing them away. And then if they are not responsive, then you would be doing the same CPR. But if they are responsive, you would activate the emergency response system. And one of the things with electric current is, Raj, that it might seem like they don't have that much injury or a small piece has gotten burned, but you can have a lot of damage internally. So the recommendation is that everyone who's had a significant electric shock, if they're not feeling okay, or even if they're feeling okay, they should probably get evaluated by an emergency room just to make sure that they didn't sustain any kind of internal injury that might cause problems a few hours later.
Mm-hmm. Yeah, that's great. And so once the all these helping others has started, so what is the end point? Like, what should people be looking for? When should they be stopping it?
That's a very tough question, especially in the US. Means I would think as long as you have enough people. If you're alone, you can get tired, and usually even in people who work in a healthcare setting, it can be tiring after 4 to 6 minutes. So hopefully help has arrived by then. You would think that it would continue. For in-hospital stuff, usually they say where around 20 minutes you want to have start having that discussion. If someone's been down, and again, you need to hit all the criteria. So you need to be warm, you need to have no underlying causes that they feel like they can treat. So once you meet all those, so I would say that for lay people, I would continue CPR till the emergency response people showed up and take them to the hospital and let the doctors decide when to stop. But for any doctors who are listening, usually around 20 minutes is when you start the discussion about, is this something that will kind of be treatable, or is this something we are dealing with which will kind of prolong for a long time and uh, can start the discussion about stopping CPR?
Okay. So for lay people, if they're continuing this chest compression and breathing, it can be tiring, sure, but while you're waiting for medical support, just continue doing it. It could be 15 minutes, it could be 20 minutes, it could be 30 minutes.
Yeah,
Do not leave doing it because you never know. You might be saving
yeah,
someone's life. And
yeah. And a lot of stories of like people who are cold, especially if they're in the pool or something like that, and they get hypothermic, which is their body gets cold, you can survive for much longer. And so the hospitals, when they come in, will warm them up. And a lot of patients, their heart recovers once that happens.
okay, okay. And let's say someone is successfully resuscitated. So what next? What position? While they're waiting for EMS, someone has been able to successfully save someone. Now they're breathing. They're doing fine. So what position should they be placed in to recover?
Uh, I think unless you're worried about like vomiting or something that's happening, which can happen, especially if you've just eaten food and you were choking on something, then you can turn them on the side. But most often they say just leave them on their back, just because these things can happen again, and then you're in the best position. So once they've recovered, they could again become unresponsive if it's taking a little long for EMS to show up. So leave them in the same position. One of the things we didn't talk about as much, but is that we need to be on a hard surface when you're doing CPR. So you don't want to be on like a bed or anything. So if you're on a bed, you can put like a board or something underneath. In a hospital setting, that's what we do. But at home, you might have to just find a hard surface. So again, leave them in that position because if it happens again, but definitely if someone's eaten, then you might want to sit them up a little bit. Uh, but probably not move them too much. The other patients I would worry a little bit about, or persons I would worry a little bit about moving, are the drowning victims and the electric current victims we talked about,
Mm-hmm.
because those kind of injuries you could have hurt your neck muscles or the bones in your neck. And if you move those patients, you might increase the risk of causing damage to their spinal cord. So just have to be careful moving patients who've had accidental. So especially even in a fall patient, like the first picture you showed us, you want to be a little more cautious moving those patients, but you do want to move them if they're unresponsive to a flat surface so you can start CPR.
Mm-hmm. So I guess if someone is found unresponsive, instead of shifting them to the bed, they are actually better off keeping kept on the floor, then start the CPR. Then it gives a hard surface, so there is better
Yeah.
pressing of the heart and chest, which then in turn pumps blood to the rest of the body. So that's the whole premise of doing those chest compressions.
Yes, exactly, Raj. Thank you for summarizing. But yeah, you want to be on a hard surface, and the less you need to move them, the better it is.
Yeah. So, Harshad, this is the COVID era, right? So we can't
That
live
is true.
without touching on the stupid COVID thing. So you never know who has COVID, who does not have COVID. So we find someone
Yes.
unresponsive. You don't know their COVID status. So how should people modify their action in given this scenario?
So there was an interesting discussion because this has obviously can happen to patients in the hospital. So doctors are actually advised to wear your N95 masks and when you're doing resuscitation because secretions will be flying. So even if you're doing just chest compressions, I would keep your mask on. If you know the person or if you know their COVID status, if you feel comfortable with it, you can do mouth to mouth. You can put a cloth on them. Some people say even if you breathe through a mask, it might be helpful than nothing. If you have a small mask like this, which some places when you do life support training will give it to you, you can use that to do it. It still has the same risk, but there is a little bit of protection. But unfortunately, when you're doing CPR, you're probably exposed to whatever that patient has, uh, for better or worse. So putting a mask on, washing your hands afterwards, taking the usual precautions is probably the best thing you can do.
Hmm. Okay.
But even if you can do just compressions only, and if you're worried about ventilating, I would still recommend doing the compressions.
Okay. So that's a good point. So if someone is putting a mask on and they're worried of going close to someone's face, they can at least press on the chest without worrying about
Yeah,
the breaths. At least they're doing something as opposed to not doing anything. Is that right?
yeah, that is correct. And then till someone shows up with like a mask like this, then you might feel more comfortable. Or some of the places which have a, uh, if you're in like a mall or a setting, sometimes they have the bags with it too, so you don't have to give the breath. That device will give it to them.
Mm-hmm.
So, but hopefully the EMS will show up. So this is for the first 2, 3 minutes. The EMS response in this country is, and the most advanced developed countries is pretty good. So usually they'll show up within 3 to 5 minutes. So you're hopefully doing this for a couple of cycles,
Mm-hmm.
is the hope. And if you have an AED, you can do one time you will be giving an electric shock to the patient. And hopefully by then someone has come who has a little more training and more equipment to deal with the situation.
Yeah. Well, if you're still in a country where the EMS response is not that quick, but you can still continue doing the chest
Yeah,
compressions and breathing until they show up. I mean, they're very
yeah,
helpful. They eventually show up.
yeah. Yes, I would agree that yes, continue as much as you can, even if you're getting tired and you're not able to do the 100 per minute and all these things. Doing something is better than nothing.
Yeah. No, that's great. So, thank you so much. This is very helpful. I do have to be respectful of your time and Ria's time because I know you have a lot of things going on. Is there anything you or Ria want to say before we wind off?
Ria shaking her head, but no, thank you for doing this. I think it's a very important message to send out to people in many countries who follow your show or the Health for Kiddies show because it is a common problem in kids, both the drowning, the foreign body, and even just the basic CPR. And that's why the kids get it when they do the babysitting courses. So it is a common problem in this age group. And if we can save even a couple of lives by having a show like this, it would be great.
Well, I have to thank you so much for your kind words and also taking your time and Ria's time for being here. I really enjoyed this, and this was so educative. So we all learned so much from you. You're the expert. You're certified. You teach other people, and so does Ria now, which is fantastic. So this is great.
All right. Thank you so much, Raj.
Yeah, thank you. Take care.
Okay.
Bye.
Bye bye.